My path into massage therapy is quite interesting. I started off when I was about 9 years old, working on my mom, working on my friends, working on high school classmates, on band trips, and things like that. So I've been doing it for a very long time.
Well, I've been doing this for 25 years, which is a long time in this industry. I've had my own practice. I worked with chiropractors. I worked at the spa, and I think my true passion is spa work, and that's my goal, is to be able to do this as long as I can do it and just continue to pamper and relax people.
Me as a male massage therapist, I deal with a lot of issues with female clients not being comfortable with having a male massage therapist because of the reputation that has been attached to male massage therapists, unfortunately. So I go above and beyond to make sure that anytime I work with a female client, they feel extremely comfortable with me treating them no matter what I'm doing.
Had this the other day, and people are nervous. You won't believe how nervous people get coming in for massage, because they all think, do I got to get naked? No, we're going to work up what your comfort level is. So I always tell them, you want to leave your underwear on, leave your underwear on. That's fine. Are there certain areas, like maybe you have ticklish feet and you don't want your feet, or maybe you're going to the grocery store so you don't want your face, you got full face makeup on. So it's just a matter of explaining to them that, this is how you're going to be draped. You're only going to be undraped in the area that I'm working. If anything feels uncomfortable, let me know. I will adjust.
With my typical treatment session, because I'm in a medical setting or in a sports setting, none of my clients get undressed, so I don't have to deal with draping. So I don't have to worry about them feeling uncomfortable with the nakedness of their body or anything of that nature. When I treat women, I overemphasize what I'm doing and I over-explain the techniques I'm using so that they understand that if I'm working in an area that might possibly be a little bit of a private area, such as the upper chest, where the pec major and the pec minor attaches, there's a lot of breast tissue there. So if I'm working in this area, I will explain that I'm focusing on either trigger points or attachment points, and my hand will be placed in this specific area. And if you're not okay with that, I will not do that. But if you are, I will continue treatment, and they fully understand what I'm doing, and I get full acceptance from them before I do any treatment.
Well, people still refer to us as masseuses. A lot of people think we're sex workers. We're in the Midwest, so it's, we're a little behind the times in the Midwest. So it's just getting people to realize that there are benefits to this. It's not just fluff and buff and, total relaxation. There's good health benefits, good physical benefits to it.
Some of the most significant benefits I've seen are people going from chronic neck pain, chronic back pain, to a point where they can't function normally as they would like to. If someone's contemplating a career in massage therapy, which I think is an extremely rewarding career, watching people recover and watching people deal with pain and helping them get out of that pain is extremely rewarding for me. So to be able to pass that on to other people, I think would be an extremely amazing experience.
People tend to drop out around the 5-year mark in massage. So after 25 years, yes, my body is feeling it. So I would say 1, pay attention to your body mechanics, and 2, find what you love, because there's so many modalities out there, so many different approaches, and find the one that you love and stick to it.
A lot of times when I'm dealing with a client who does not follow my after treatment advice, I usually try to use personal experience or experience from other clients to explain the importance or the necessity of doing post-treatment protocol, such as self-care or following stretching or exercises or drinking water, staying hydrated, any of those things. I stress the importance by using experiences that I've dealt with in the past to explain the importance. And then when people do come back and have done those things and they see improvement, I reiterate that they feel better after doing those, so they should continue.
It's just getting people to realize the benefits of relaxation and that it's okay to take some time for yourself and let somebody pamper you a little bit. You deserve it.
If you do these after treatment protocols that we've talked about, you will get better and you will feel better. If you don't do them, you will not get better.
I can't make somebody do something they don't want to do. I can suggest it. I can explain to them how it will help, but it comes down to them, you know.